Hola. Ngamo, Bokulak, Losakomo, petit frère. Abonnement. Il faut bien s'abonner. Tous en avez support. Tous en avez besoin aussi. Aide na yo. Hi, how are you doing? Munganga, Dokotolo, Dr. Gombele. Now we are going to talk about the side effect of Diabinese or chloropropamide, the drug within the family of sulfonylureas, the big family. We say that we were talking about the first generation, first members of the family. First, because they were produced first. First, because they were the first people used to treat diabetes type 2 along with diet, exercise, and education. About the side effect, we cannot predict who is going to develop what side effect or who is not going to develop what side effect. And the side effects are not you take the medication today and tomorrow you develop the side effect. You could be taking the medication for 10 years and lo and behold, one day the side effects occur, right? And the same for allergic reaction. People say, oh, but doc, I've been taking this medication for many, many years, but I never had the allergic reaction. It doesn't work that way. It could be the first time in contact with the medication, allergic reactions occur, or many years after, allergic reaction occurs. But what we want to know, what we want to do to expose you, to inform you, to alert you to the side effect of this medication, because they are, right? Even though it's not being used in the American market, but in the Caribbean, we have people with diabetes. I have patients, I said earlier, who came to me with the medications, right? So it's working. So I don't need to change it. But then I just tell them about the existing side effect in case they develop, they have to go to see the doctor urgently, right? The most common side effect of this drug is hypoglycemia, right? What is hypoglycemia? Is low blood sugar or low blood glucose. It stays longer in the body, and the longer a medication stays, more effective it becomes, and then it can create a lot of problems. So how do you know that you are having low blood sugar? Number one is to check, right? Because sometimes the symptoms are different. You may have a little bit lower, but you're quite fine. But the other one, as it goes below 3.7, they start having the problems, right? While in other persons, the problems do not come until it's like 3.1 or 2.9, right? And I've seen patients with 2.9, they are okay. They may just say, I'm a bit nervy, right? So the signs and symptoms of low blood count, which is the most common side effect of diabetes, are headache, right? Sudden headache. You are quiet and suddenly you develop a headache. Or hunger, right? Hunger because the glucose has been consumed by the drug and you start feeling hunger, right? Sweating profusely in your hands, right? Tremor, shaking of the hand. You start shaking and you become irritable, right? Now, irritability, you will not know. The person next to you will find out, what is that? Anything you just blow out, right? Now, if the person is diabetic, watch out. Check the sugar. If you have a sudden headache, you're diabetic, watch out. Check the sugar. I tell all my diabetes patients, any change in the way you feel, before you call me, check your sugar, right? Trouble concentrating, trouble focusing, right? This can be also a sign of hypoglycemia, low blood count sugar, right? Fainting, you feel like dizzy spell, or seizure. Suddenly somebody develops seizure, right? He can help himself. We have to do it that time, all right? Or loss of consciousness, right? All these are the signs and symptoms of hypoglycemia. And the most common medication in this family that give hypoglycemia is what? Is Diabinese or chloropropamide, right? So we have also a series of common side effects which do not really need medical doctor intervention or to change the medication, such as a little bit of vomiting, nausea, bloated abdomen, a little bit of loose stool, diarrhea, a little scratch here and there. So in this case, what we do, we will just change the way we administer the medication. If I was giving it to you 500 milligram in the morning, then I would say, okay, let me now space it. Maybe twice a day, every 12 hours. And the side effect subsides a little bit. You still complain. I say, okay, I'm going to give it to you every 8 hours. So I reduce the strength of the medications. If I have to give you 500 once daily, and if I decide to give it to you twice daily, I divide 500 by 2. So you're going to have less strength, but twice daily. Or if still I want to divide that by 3, then I can give you 200 every 8 hours, right? So these are side effects that not really serious, doesn't really affect individual per se. So there is no need to discontinue the medication. In this setting, we just modify the way we give the medications. But there are a list of serious side effects: unusual fatigue, tiredness. But some people say fatigue is like, doc, I feel like somebody needs to push me before I walk. I'm very tired. Like to lift one foot and to lift another one, it takes the world from me. I have to use all my strength to do that. And you're on Diabinese, talk to the doctor, right? Pounding heartbeat, boom, 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 boom. You're quite fine. You're not on menopause, right? You don't have anxiety disorder, even though you're on menopause, even though you have anxiety disorder. But a rare, aware heartbeat, you need to go to the doctor. Do not sit and wait and watch, right? And especially if you are taking Diabinese. Easy bruising or bleeding. You brush your teeth, you see the blood. Strange, right? You bleed easily, right? You go to the doctor, they do the urine test, they see blood in the urine, right? That's not usual. And the dentist can even tell you, any bleeding while brushing your teeth, it is not normal, right? You have to report that to the doctor. Sudden weight gain, right? Suddenly, you're taking your medication, and you didn't have a weight gain. Suddenly, you start having weight gain. That means what? You are retaining fluid, right? The clothes get tight before even you develop shortness of breath, right? And then sudden weight gain, and then now you see your hand swollen, and your also feet have become swollen. That's not even nice. That could be the heart or the kidney, right? So you have to talk to your doctor muscle weaknesses, right? You feel muscle getting tired, weak. Let your doctor know. Bloody stool, right? Change in the complexion of stool. The stool becomes like a polish, right? And when we do a rectal examination, we put the finger in the anus, and when we put back the finger, you can see like a polish on the tip of the finger, right? That means there's blood mixed with the stool somewhere, and you are bleeding internally, and you can't sit and watch. You have to report that to the doctor. Yellow eyes or skin, that may be liver means liver getting involved, so you have to report to your doctor. Dark urine color, report to your doctor. Sudden onset of seizure. You don't have seizure, you don't have any history of seizure, and then you're on Diabinese or chloropropamide, and suddenly you develop seizure. You will not know you're developing seizure, but people tell you had seizure, blood in the mouth, maybe you pass your stool, urinary incontinence. You say, but why, right? And then you are on Diabinese. Tell the doctor. It can cause a seizure, it can cause bleeding, it can affect the kidneys, it can affect the liver, right? So you have to tell your doctor. Before we conclude, I'm going to invite you again to like, share, subscribe, leave your comment at the end, at the bottom. We will gladly answer to them. And also, click the notification bell so that when we upload our very next videos, you can be notified. Conclusion, what are we saying now here about chloropropamide and or Diabinese? It is a long-acting first-generation medication of the what? Sulfonylurea. Because it has sulfur, look out for the side effect of sulfur. If you are allergic to sulfur already, look out, right? 2, we do not recommend the medication for the newly diagnosed patient, right? The medication of choice for the newly diagnosed patient is what? Metformin. But you are on Diabinese and you are quite fine. You have been taking it for 5-10 years. You get pregnant, you stop. Until the baby is born, the baby discontinues taking the breast, then you go back to your medication, right? So it is, we don't recommend it for during the pregnancy or for the ladies who are breastfeeding, right? We do recommend, for the continuation if you are already on the medications. If you want to lose weight, it is not the medication of the choice, right? Keep your regular checks with your doctor. It is during those checks that we find things that do not work, right? And I don't like writing prescription for 6 months or for 1 year because I can miss you. We can miss the side effects of some medications. Keep your date. If it's every 3 months, if it's every 4 months, or the doctor told you because you are doing so well, you can come every 6 months, but do not miss, right? And any new things, all right, new medical circumstances or condition that you have never had before, call the pharmacist, call the medical doctor. So this is it now. Though the medication not longer in the US market, but it is used in Jamaica here, in the Caribbean. So look out for the side effect that we have mentioned earlier. If you see that any of the signs and symptoms happening to you, you call your doctor, right? Or you call the pharmacist, or you call a nurse for further management or treatment or referral to the person who can take decision where the use of the drug is concerned. Mwana mboka, mbote malamu. Au revoir mon ami. Hasta luego amigo. Monganga, Dokotolo Gombele. Bye bye. God bless.